Endometriosis is a chronic medical condition that affects many women worldwide. It is characterized by the presence of endometrial-like tissue growing outside the uterus, leading to pain and potential complications. The exact prevalence of endometriosis among women in the USA is not definitively known. However, estimates suggest that approximately 10% of women of reproductive age may be affected by this condition. Endometriosis is a painful disorder characterized by the growth of tissue resembling the lining of the uterus, known as the endometrium, outside the uterus itself. Typically, this condition affects the ovaries, fallopian tubes, and the lining of the pelvis. In rare cases, endometrial-like tissue may be present in areas beyond the pelvic region. In the case of endometriosis, the abnormal tissue behaves similarly to the endometrium during the menstrual cycle. It thickens, breaks down, and bleeds with each cycle. However, because this tissue has no exit route from the body, it becomes trapped. When the ovaries are affected, the condition may lead to the formation of cysts called endometriomas. Additionally, the surrounding tissue can become irritated, leading to the development of scar tissue and adhesions. These fibrous bands can cause pelvic tissues and organs to stick together. Endometriosis often brings about significant pain, particularly during menstrual periods, and may also result in fertility issues. Fortunately, effective treatments are available to manage the symptoms and address the condition. Types of endometriosis. Endometriosis is also grouped by what area of the pelvis or abdomen it affects. There are 4 main types. 1. Superficial peritoneal endometriosis. The peritoneum is a thin membrane that lines your abdomen and pelvis. It also covers most of the organs in these cavities. In this type, the endometrial tissue attaches to the peritoneum. This is the least severe form. 2. Endometriomas. These are dark, fluid-filled cysts. They're also called chocolate cysts. They vary in size and can appear in different parts of your pelvis or abdomen, but they're most common in the ovaries. 3. Deeply infiltrating endometriosis, DI. In this type, the endometrial tissue has invaded the organs either within or outside your pelvic cavity. This can include your ovaries, rectum, bladder, and bowels. It's rare, but sometimes a lot of scar tissue can bond organs so they become stuck in place. This condition is called a frozen pelvis. But this only happens to 1%–5% of people with endometriosis. 4. Abdominal wall endometriosis. In some cases, endometrial tissue can grow on the abdominal wall. The cells may attach to a surgical incision, like one from a C-section. Symptoms and characteristics of endometriosis. The primary symptom of endometriosis is pelvic pain, often associated with menstrual periods. Although many experiences cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that's far worse than usual. Pain also may increase over time. Common signs and symptoms of endometriosis include 1. Painful periods, dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into a menstrual period. You may also have lower back and abdominal pain. 2. Pain with intercourse. Pain during or after sex is common with endometriosis. 3. Pain with bowel movements or urination. You're most likely to experience these symptoms during a menstrual period. 4. Excessive bleeding. You may experience occasional heavy menstrual periods or bleeding between periods, intermenstrual bleeding. 5. Infertility. Sometimes, endometriosis is first diagnosed in those seeking infertility treatment. 6. Other signs and symptoms. You may experience fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods. The severity of your pain may not be a reliable indicator of the extent of your condition. You could have mild endometriosis with severe pain, or you could have advanced endometriosis with little or no pain. 7. Endometriosis is sometimes mistaken for other conditions that can cause pelvic pain, such as pelvic inflammatory disease, PID, or ovarian cysts. It may be confused with irritable bowel syndrome, IBS, a condition that causes bouts of diarrhea, constipation, and abdominal cramping. IBS can accompany endometriosis, which can complicate the diagnosis. Always consult your doctor for professional help. In the next video, Part 2, we will discuss the risk factors, causes, and treatments. Thank you for joining us as we explored the nature of endometriosis. Subscribe to our channel to stay informed and receive future informative videos.